Our 2022 Provider of the Year, Dr. Robert Harding, is a man who needs no introduction. His legacy as an outstanding care provider, his decades of leadership, and his belief in the power of philanthropy are all just some of the things that make Dr. Harding the beloved leader he is today.
Bob is one of the best physicians I've ever met, and there are a number of reasons for that, the most important of which is he really cares about people. He's also one of the smartest people I've ever met and one of the hardest working people I've ever met, and those things make him one of the best doctors that I've ever met.
My first impression of him was what a wonderful physician that nurses love to work with. And as a nurse, that is joy.
But he's also considerate and empathetic and very articulate. So he's really everything you want as a physician when you have a patient in need. And frankly, he's everything you want when you are the patient in need.
When you think of a physician's physician, you think of Dr. Harding. Dr. Harding was in practice in Williamsburg for decades, and people loved him. I mean, he was interested in them. He was interested in what was going on with them. He took time to really understand that, and he has never forgotten that. And then when he joined Riverside and became part of the hospitalist team, he brought that same expectation.
He uses his secret powers for good, and he quickly identifies that the best legacy you can leave a newly evolving organization is a legacy of culture. We bonded over, I hope, our belief in the concept that culture can eat strategy for breakfast. Dr. Harding has a secret weapon. He has secret powers, but he has a secret weapon, and his secret weapon is named Nancy.
After college, where Bob actually studied engineering and then switched to economics, not biology, nothing to do with medicine. After that, he and a close friend went up to Burlington, Vermont and opened a college bar. Yes, they opened a college bar in a college town. So it was, very busy. He did that. We had 4 little girls, and I just thought life was great, life was perfect. What a wonderful place to, raise these children. And Bob felt all of that too, but he wanted to do more than that, and felt that medicine held the promise to fulfill his dreams.
So when he and Nancy decided to contribute through scholarship for education, it was no surprise. It was also, my understanding, a huge gratitude move, because he was so appreciative of the staff and the team that worked with him, and on occasion, as he would say, could really make him look smart.
And another part of the motivation, the dedication to that idea had been that one of his sisters had died while she was studying to get her RN. And it meant a lot to be able to help someone else who had the same goals that she did, but she couldn't finish it.
So Dr. Harding and his wife met with the foundation and myself to really talk about where could his scholarship dollars make the most impact. And the practical nursing students do have the greatest financial need, and it makes just a tremendous difference for someone to come in with no college experience, go through a 1-year practical nursing program, and come out with a very lucrative career in nursing.
Every step along the way, the Hardings have raised their hand to help Riverside. When we were addressing cancer care and integrative therapies for the Ellis Fund, they raised their hand. When we were addressing hospice and what our patients needed, they raised their hand.
Bob has always been a big advocate for philanthropy. It goes from encouraging physicians to starting projects or looking into projects on his own. But he's also been a strong advocate for physicians to give back, and he leads by example.
Now, if you know Dr. Harding, you know he's the leave it better than you found it kind of person. So when he began to talk about how important philanthropy was for physicians to be able to lead and understand and guide patients toward, I was spellbound in the conversation. Everyone knew him and trusted him, believed he was a compassionate, thoughtful, dedicated doctor. But little did they know that he would become the philanthropy leader that we needed him to be.
And he had all of his priorities about all the meetings and things he was going to, but really above and beyond that was the care of his patients, and that was the most important thing that he always held in his heart. So.